Good afternoon. I'm Naomi Johnson-Effinger, Associate Director of ABC Hospital here in Selma, Alabama. Thank you all for coming to this presentation. The projected proposal that we are presenting is concerning clinically integrating electronic health records for the entire organization. In recent months, our patient satisfaction has begun to decline. Some of the reasons for the declines include patients having to transport paper records to and from the hospital, complaints of the facility performing duplicate tests because health records were not accessible, follow-up of post-diagnostics not being done because of a lack of accessibility to the providers, a lack of communication between departments within the hospital, creating fragmentation of care, and a lack of communication between the departments. Complaints that the timing of care is delayed because of updates in real time and that they're not really accessible. Complaints that test results are not readily available to the physicians, causing delays in treatments. And there's little or no follow-up post-discharge with patients, causing readmissions that could have been prevented. In slide 2, we're going to present some ABC Hospital facts. As you can see on the screen, ABC Hospital serves 7 counties. These are the poorest counties in the Black Belt region of Alabama. It serves these 7 counties in west central Alabama, and it competes with 7 larger hospitals in a 100-mile radius to its location. ABC Hospital currently serves 330,000 patients a year. That census has increased by 5% each year for the past 10 years, and it's anticipated to increase by 5% in the next fiscal year. The ABC Hospital has a current general budget of $1.2 billion operating expense, and it has a $2.5 billion asset. The facility operates at 90% capacity 365 days of the year. The patient satisfaction survey this year identified 12 areas of improvement. 8 of those areas can be resolved with the implementation of electronic health records organization-wide. The analysis is that 75% of the patient complaints are due to the outdated health record system in the organization. The overall purpose of this project is to create a medium in which the hospital, providers, and outpatient clinics can communicate electronically. This will call for the integration of information technology of all of the organization that will interface with each other. The hospital will resolve 75% of the issues or concerns of the patient satisfaction survey by implementing this particular project and enhance quality of care. In this next slide, you'll see that there are several programs that can be utilized to reach our goal. However, there are 3 programs that are excellent and are what we're searching for to help us exceed the expectation of our customers. The CFO, CIO, and COO have all agreed that either of these choices would be acceptable, but they have one that they prefer. The group eliminated others who did not meet their goal, and these 3 are the ones from which the choice will be made for ABC Hospital to use. They are, as displayed on the screen, McKesson, Epic, and eClinicalWorks. It will enhance patient care and improve patient outcomes to utilize digital records. The use of information technology will bring the patient and the physician into the same field of service, opening needed lines of communication between every department and needed provision of necessary patient care. The use of IT will offer a multidisciplinary approach to patient care, and with each discipline, it will allow sharing of information, making it readily available. It will defragment healthcare at ABC Hospital and offer enhanced patient outcomes. In our next slide, we'll take a look at how we do business. In terms of how we at ABC do business, we need to understand our payer sources. For ABC Hospital, we're utilizing a payer source mix that breaks down into the scenario that you see displayed in this slide. 30% is Medicare, 30% is Medicaid, 25% is private insurance. All of these entities require digital records. Self-pay is 14% and indigent is 1%. ABC Hospital has at its core value and goal the provision of the best quality of care it can provide. It desires a reduction in medical errors, and the utilization of EHRs will assist in that endeavor. Patients will never have to carry records from one department to another or from one provider to another ever again. Medical claims will be made electronically, causing for faster reimbursement here. The EHR is designed to share information such as hospital to payer source and to share information among providers of care as well. This alone will improve continuity of care. It will also enhance patient care. Value-based care has replaced fee-for-services, this being driven by public policy, and it is a desire for quality of care. The data obtained from these electronic records will also be used for research, and it will help to reduce our errors in rendering that patient care that we are working so hard to improve. What then is the outcome? Data USA tells us that in Selma, Alabama, there is a population of 41,426 people. This is a decline in our census over the past year by 1.76%, with a median age of 38.9 years. The average annual income per family is just $28,136 per year. That is a recent increase for this poor area of 3.04%. ABC Hospital can provide 3 different levels of framework for the implementation of this project. The first level is that of application service providers, or ASPs. The second level is that of a server-based system, and the third is an open source system. All 3 HR systems are good for the goals of ABC Hospital. However, systems that carry large fees for licensure are usually server-based or vendor-based systems. They usually cost about $75,000 or greater, with an overall cost of somewhere between $25 and $55 million for a hospital that has 500 beds as a capacity. Since ABC has a lower capacity at 300 beds, we can see that the cost will be lower, on the end of $25 million or less for overall cost. And that's what we're after, the best for less. In this next slide, we're going to take a look at economic incentives versus challenges. As with every project, challenges are going to arise. One of the challenges will be that of installing the framework, implementing the system, training the staff. All these hurdles can be managed the very same way that one eats an elephant, one bite at a time. The advantages of utilizing EHRs far outweighs the disadvantages, as we've already discussed. It is an improvement in quality of care. It will help to reduce medical errors, improve patient outcomes, and it will improve communication among the multidisciplinary task force and improve the timely diagnosis of all of our patients served. This system will enhance the overall operational performance of ABC Hospital. It will also establish a faster reimbursement system for the entire network. In addition, the use of the data retrieved from EHRs will help with national research and allow for opportunity to reduce but improve quality management for our organization. Yes, there will be temporary disadvantages that is a part of the implementation of technology. These disadvantages will be short-lived and will occur during the training process on each unit brought online with the new HR program, one unit at a time. One major advantage is that of being HIPAA compliant. The system will prevent breaches in confidentiality and privacy. I'd like to thank you all this afternoon for being a part of this presentation, and at this time we will return the floor to the director.